Today we're diving into a condition that millions of people think they have, but that scientists say is just widely misunderstood. We're going to get to the bottom of what's really going on with chronic gastritis. So maybe you've been told you have chronic gastritis because you deal with this recurring, just frustrating stomach pain. It's a super common diagnosis, right? But what if I told you that for most people that diagnosis is basically a myth? Yeah, you heard that right. The actual scientific evidence paints a completely different picture, and it all starts with a huge misunderstanding in how gastritis is diagnosed in the first place. Okay, so for a lot of people, the diagnosis comes after a doctor has a look inside their stomach with a tiny camera, an endoscopy. But right there, that's where we find our first big clue that something is off. That's right. Just looking at the stomach lining isn't enough. Why? Because true gastritis isn't about what your stomach looks like. It's about what's happening way down at the microscopic level. Now check out this word here, morphological. It sounds technical, but all it means is that the diagnosis depends on the actual structure of the tissue, something you can only see under a microscope, not just its appearance to the naked eye. So let's be super clear about this. That third step, taking a little piece of tissue and looking at it under a microscope, is absolutely essential. Without a biopsy, you don't have a confirmed diagnosis of chronic gastritis, period. That is the scientific gold standard. Okay, so let's say a doctor does take a biopsy and they find real actual inflammation. What's causing it? Well, I can tell you in the vast majority of cases, it's not the spicy food you ate last night. Sure, things like autoimmune issues or popping too many pain relievers can play a part, but the science is crystal clear. Most of the time, chronic gastritis is caused by one specific thing, a bacterium called H. pylori. So we've identified the cause of the inflammation. But this brings us to the biggest mystery of all. If this bacterial infection is the real problem, why is the infection itself silent? Why doesn't it cause pain? To solve this, we actually need to flip the question around. Instead of asking what causes the pain, let's ask what are the symptoms of real biopsy-proven chronic gastritis? And this number right here just says it all. A whopping 80% of people with confirmed chronic gastritis have zero symptoms, none. It's a completely silent condition. So that pain, the bloating, the awful discomfort that millions of people are told is gastritis, most of the time it's actually this functional dyspepsia. This isn't a problem of physical inflammation, it's a problem with nerve sensitivity and how the stomach functions. So what triggers it? Well, as you can see, while it can sometimes start after an infection, it's most often linked to things like stress and anxiety. It's a condition of what's called visceral hypersensitivity, which is basically a fancy way of saying the brain gets its wires crossed and interprets normal stomach activity as pain. So you might be thinking, okay, silent gastritis, painful dyspepsia, who cares what it's called? Well, it actually matters a whole lot because real untreated gastritis isn't harmless, it's a progressive disease. This timeline here is known as Carrasco's cascade, and it shows exactly what happens. Over many years, that silent inflammation slowly damages the stomach lining step by step, creating a pathway that can eventually lead to stomach cancer. And this is why getting the right diagnosis is so critical. When you treat the root cause, which remember is usually that H. pylori infection, you can stop this progression dead in its tracks. It's one of the most powerful cancer prevention tools we have. For decades, we've all been told to treat our stomachs like they're a delicate crystal vase, right? Avoid anything spicy, anything acidic. But you know what? The science tells a completely different story. Let's just bust some myths right now. There is zero scientific evidence that these crazy restrictive diets either cause or cure true gastritis. The real damage, the stuff you can actually control, comes from lifestyle factors. We're talking smoking, heavy drinking, a high-salt diet, and overusing certain painkillers. And if you need any more proof, just look at the data on ulcers. It's overwhelming. When you leave H. pylori untreated, there's a 70% chance an ulcer comes back within a year. But if you treat the infection, that number plummets to just 4%. It's a night and day difference. So, after digging through this whole diagnostic mystery, what are the most important things to walk away with? Let's break it down one last time. Look, if there's one thing to remember, it's this. We have to separate the silent disease, which is gastritis, from the painful condition, which is dyspepsia. One is about hidden damage to your tissues, and the other is about nerve sensitivity. If you confuse the two, you end up trying to solve the wrong problem. The whole story of gastritis is just a powerful reminder that in medicine, what we feel isn't always the full picture. By questioning these common beliefs and pushing for the real diagnosis, we can shift from just managing symptoms to actually preventing serious disease. And it kind of makes you wonder, right? What other health myths are we all just accepting as fact? Dear friends, if you enjoyed this video, please give it a like and don't forget to subscribe to this channel so you don't miss new useful videos. If you have any questions, write them in the comments. I'll be sure to answer. Stay healthy.